I'd like to start with a story. A 10-month-old girl was admitted to the hospital with tetralogy of Fallot, the classic blue baby syndrome treated surgically for the first time in 1944, in a daring feat that extended the bounds of what was thought to be humanly possible. The celebrated white surgeon and his unheralded black technician had practiced for months in the laboratory to master the new techniques. Now, many decades later, operative repair is routine, and this baby's story should have been forgettable. But Allie remembered the baby well. Over a year later, she stood in front of her medical school classmates and presented the baby's case, not to unravel the mystery of cardiac anomalies, but to probe a far more complicated mystery. Why congenital heart disease is deadlier for Black babies than white babies. I listened in the back of the classroom, ostensibly the teacher, as Allie led a thoughtful discussion that elucidated reasons for the disparities. There are no wayward, race-related genes, just commonplace social and economic woes, like the ones that shaped the lives of this baby's family. Recently moved from New York City to a town 50 miles away to escape financial hardship. A job promised that never materialized, leaving both parents temporarily unemployed. A gap in the baby's Medicaid coverage. 2 other school-aged children, 1 car, no gas money, no extended family support. No time to pursue the baby's follow-up care until she became dangerously ill. Allie had been assigned to the medical team overseeing the baby's treatment, and the team didn't know any of this at first. They were excellent doctors, but they were busy, and all they'd seen was a very sick baby who should have had an operation months ago. The mother and father were bad parents, often absent, always adversarial, and oblivious to their daughter's grave condition. Over the course of the hospitalization, the situation had only deteriorated, and it wasn't clear that the baby would receive the treatment she needed. While it wasn't Allie's intent in telling this story, she gradually emerged as its hero. So how could a clerkship student end up being the hero of a story like this, about a sickly child who desperately needed a heart operation? It was through the completeness of her caring. Caring, as the KNN defines it, involves more than providing excellent medical treatment or exhibiting a kind demeanor. These are necessary, but they are not sufficient. Based on the works of Virginia Held, Milton Myeroff, and others, the KNN definition states that caring is a blend of practices, dispositions, and motivations, all aimed at ensuring that individuals and populations grow, develop, and flourish as best they can. It derives from the moral basis of caring relationships in which those who give care act intentionally and deliberately to nurture and uplift those who receive care. In her writings on the value of caring in our society, Joan Tronto, a political scientist and ethicist, deconstructed this kind of caring into 5 moral elements: attentiveness, responsibility, competence, responsiveness, and respectful, engaged citizenship. Allie practiced all of these elements, and in doing so, she cooled the simmering hostilities that had developed, cleared misconceptions, and allowed the baby's parents to accept a treatment plan. So how exactly did she do it? Well, Allie was keenly attentive. She inquired and listened and uncovered information that told an entirely different tale about the parents' behavior. They were not bad parents. In fact, they were devoted parents, just confused, frightened, and depleted. And Allie was responsible. Once she understood the financial challenges faced by the baby's parents, Allie didn't simply commiserate with them. She related the full story to social workers who were then able to issue meal tickets and gas cards for the daily visits and trips back and forth. She was responsive, frequently checking back on the parents and building their trust and understanding and ensuring that her efforts helped to ease their concerns. And she was a respectful, engaged citizen, learning about the obstacles people face in trying to achieve optimal health and honing the skills needed to advocate for equity. Allie did not yet have the technical competence of the cardiologist who stabilized the baby's condition or the surgeons who repaired her heart, but she understood that developing her own competence in medical school was about much more than getting good grades. Competence is a moral imperative, not a technical to-do list, if one is to become a truly caring physician. Although it was not originally developed for medicine or healthcare, this comprehensive framework will direct the KNN's efforts in promoting caring. The 5 elements can provide guidance for teaching, assessing, and measuring outcomes within health professions education, within health professions, and within the health ecosystem. While caring for patients remains central in this framework, it also requires that we care for our teams, our institutions, our communities, and our democracy, so that the conditions that enable equitable flourishing can prevail.